Okay, part 4. Man, I'm a slowpoke. I'm sorry. Okay, so by the cutoff of part 3 and now, I already pushed in my medicine and I've got another syringe of saline to flush with. And again, it's a good habit to pulse flush all the time. It just helps things get cleaner easier. It's just like when you have a hose and you're trying to clean something. You can have a nozzle that concentrates the pressure. This is sort of a similar thing. When you push, it'll push the fluid through your line faster and then relax faster and relax. It just helps push out anything that might be like sticking on the wall. So even if you're just flushing, not injecting meds, that's what I do. A little bit about injecting Phenergan. I'm okay just straight injecting, but there actually has been a new protocol implemented, I think in the past year, that they found that direct rapid IV push of Phenergan can cause significant drop in blood pressure. So the recommendation now for most patients, I'm doing my heparin now, you guys saw that already. And again, I moved my clamp, and then I can go and clamp and I'm done. Which I'm so glad about because I am so hot now. Okay. So the new protocol is that you dilute it in a 10 cc syringe. Best way to do that, let me demonstrate that actually. Where is it? Okay. Extra saline. Somewhere. I don't. Alright, let's just pretend one of these is full then. Okay, so this is our imaginary full saline. Alright. And then, okay, where is it? I'm not that organized for this one, you guys. I'm sorry. Where does my needle go? Alright, anyway. I do need that. Darn it. Did I put in the sharps? I don't know to put in the sharps. Don't mind me, I talked to myself. What was that? Oh, that wasn't important. Come on, where the heck is it? Alright. I'm just going to open a new one for this. Alright, so if you're going to give Phenergan by the new protocol, then you're going to go ahead and drop like we did before. Actually, I'll show with another one just to illustrate. Again. Okay. I thought I had another one, but I'm not seeing it. Anyway, you draw it up the same way as before, and then once it's in your needle, then you can take a saline, take the cap off, and flick your bubbles out and all that. Push up. And then you could take your needle, and you take it off again, and you put your needle inside the syringe of saline. Be careful. Be very careful. And then you're going to pull back on your plunger, and this will pull the saline out of the saline syringe and into the syringe that you have the Phenergan in. And that dilutes it. The 10 cc dilution is what's recommended for a 25 milligram dose. And then you go ahead and recap your needle like I showed you. Put the cap down and put your needle towards it to get it on. You don't want to grab it. Then you're ready to go. You can take it off and attach it to your lumen. And this is supposed to be infused. I think the recommendation is 2 to 4 minutes. I'll put a little annotation. I'll go look it up. So if you are not able to just direct inject, that's how you would dilute your medicine. And then flush like I showed. Thank you for paying so much attention and putting up with 4 parts of this dang thing. I'm going to do a dressing change thing too, like I said in my first version of this, or the part 1. I looked for some good ones on here, and I noticed that even the nursing education ones that I watched, there's like 1 or 2 things that I would have done different. So I'm going to make a video about that too. And of course, if anybody has any questions, comments, or feedback, I'd be really grateful. So happy line maintenance, and may you have a long life with it, and may you never get infected. Take the time to practice sterile technique. I cannot stress this enough. It is worth it. Yes, it's a pain in the ass. Yes, it gets annoying after a while. It's worth it. It is worth it. So please take your time and take care of your line. Alright, bye-bye.